Hi, good morning, YouTube. Thank you for tuning in for today's YouTube live video. We are sticking to our topic, talking about skincare at every decade, and we have moved on to the 40s. So this week, I will be talking about skincare in the 40s. Feel free to ask questions in the comments. If you're not already subscribing to our channel, please do, and please hit the thumbs up video if you're enjoying these videos. So when we think of the decade of the 40s, there's a lot that can happen. Obviously, things differ whether you're a man or a woman. If you're a woman, people are still having babies in their early 40s. And then there's also women that are reaching early menopause and things like this in their late 40s, where they could be losing a lot of estrogen. And this can definitely affect the skin. But in general, the extrinsic aging that you've been getting throughout your life, all of the times you've been in the sun when you shouldn't have been, every sunburn you had as a child, pollution, visible light, all of these things are slowly starting to catch up with you, and they can become a little bit more visible in your 40s. So you will start to see things like texture changes within the skin, and as texture changes, it can make fine lines a lot more visible. Of course, also when you're losing collagen, this can also make the appearance of pores look larger and things like this. So things can definitely be accentuated. Again, you're going to have that decrease in collagen, which also causes a decrease in elastin. Overall, for most people, the skin tends to be a bit drier, but that's not a rule. I've met very oily patients still in their 40s. So when you think about this, what skincare are you going to use? You're going to use definitely a gentle hydrating cleanser. MDPen's is going to be wonderful for this. And you're definitely also going to want to have vitamin C serum, which of course I'm always talking about on here. And right now we do have that gorgeous Smooth and Bright holiday bundle, which is going to have our vitamin C in it, as well as our radiant retinol. And if you're buying this as retail, this is very heavily discounted, guys. I believe it's discounted by like $21. We also do, of course, have a discount for our professionals, but just to let you know, there is definitely a significant discount there with these two products. I see questions piling in. Let me look through them here. Okay, so back to talking about premenopausal dryness. This question is, how about premenopausal dryness or hormone-related problems? What ingredients should I look for to address that? So sometimes you can have pigmentation changes and also, of course, dryness. For pigmentation, honestly, CE brightening serum will be your morning product for antioxidants. If you really are getting melasma or something like this, you definitely do want to see a doctor who can prescribe something, or maybe they have a compound of hydroquinone that they have in their office. So you may need something like this, or even a kojic acid. As far as dryness, obviously you need to be using something more creamy, very packed with ceramides. For that, I would definitely recommend the Revita Peptide Cream. This is going to be your best friend. You're also going to be able to use it on your neck. And as always, I'm going to recommend our human-derived growth factor gel, because you want to bring in the big guns at this age. In your 20s and 30s, you can get by, possibly skipping certain products and not having, this extensive regimen. In your 40s, if you want to keep up with everything, you're going to be reaching for more products. So it's definitely worth investing in the human-derived growth factor gel for these problems, as well as others in your 40s. I do want to also link that Smooth and Bright kit I talked about right here, guys. This is the big holiday kit savings we are offering. If you have something that you are looking to get that's outside of this kit, you can definitely use that code FAB40 that was displayed there. I see another hyperpigmentation question. So definitely consult with your doctor, consult with your skin specialist. It depends on the type of hyperpigmentation. If you have, you should definitely be getting annual dermatological skin exams by your 40s. If you have, any type of marks, moles, things that you can't see on your back. And when you're there for your annual skin exam, it's good to discuss things like hyperpigmentation and ways to treat it. There's going to be a combination of things such as treatments and skincare that can definitely help. You do, of course, want to keep the skin moisturized, because when your barrier is not intact, this can give way to excess hyperpigmentation. For those of you that are microneedling patients, you do want to make sure that you're on something to help suppress pigment. If you are someone prone to hyperpigmentation, especially melasma, make sure you're using something for that. Let me see. I see more questions coming in. How can I prevent fine lines and wrinkles? So you do have options, don't worry. In your 40s, you can definitely prevent fine lines and wrinkles if you want to do a neuromodulator, depending on the brand or whatever. What neuromodulators do is they will control you from using a certain muscle. So if you're someone who, frowns a lot, uses your glabella, you may want to have that treated. Forehead, if you're constantly raising your eyebrows, creating lines there, or crow's feet area, perhaps. Also, there's off-label areas, like if you clench your chin, if you have TMJ, stuff like that. But this is going to be, an excellent way. Of course, RF microneedling, guys, this is going to be an ideal procedure, because it's not only going to help your tone and texture, but it's also going to help increase collagen. And you definitely need that added help in your 40s. Doing something a little bit beyond regular microneedling is really going to benefit you. You're going to get that extra tightening from the RF microneedling, and your provider may even add an RF handpiece strictly for tightening into your RF microneedling series. So these are all things to consider. You've got to wear sunscreen. If you're not already in the habit of wearing sunscreen every day by your 40s, you need to do it. I've met people that are like, oh, well, the damage is done. I didn't wear sunscreen as a kid. I had all these sunburns. It doesn't matter. You still need to wear your sunscreen. There's so many different options out there for sunscreens these days. Everything from creams, lotions, gels, sticks, aerosol sprays, sunscreen in a compact, tinted sunscreen, BB cream type sunscreen. So you have a lot of options, no excuse. Make sure you're using that sunscreen, even powders that you can reapply over your sunscreen that are mineral sunscreen powder. How many serums can you use daily for layering? So you really don't need to use more than a couple serums. If you are, let's say, using our vitamin CE brightening serum, and you're also using cellular renewal, something like that is okay. But if you feel like you're really layering on serums, that's when you really need to invest in a cream-based moisturizer, because the serums, might not be cutting it. And as we move to winter, which tomorrow is actually the first day of winter, I'll be talking about that on LinkedIn. You're going to need something like the Revita Peptide Moisture Cream. This is going to have your biopeptide blend of amino acids. The oils that are in here are all very healthy for the skin: jojoba oil, rosemary oil, ceramides, nothing like mineral oil or something that can, upset the skin. You've got HA in here, squalane, a bit of vitamin C in here. And then, of course, you do have your growth factor for the neck. So in your 40s, you really want to have these two. You can do one in the morning, one in the evening. If you want to use the Human Dry Growth Factor gel in the morning, I would suggest applying it as a very thin layer. And this is a product that is safe for the upper eyelids, guys. There's not many out there. This is a very sensitive area, very thin skin. So when you use this, you can use it all the way up to the eyebrow, all around the crow's feet and the infraorbital area. Revita Peptide Cream, you can use both if you have both. And of course, the Revita Peptide does pair very well with the retinol in the evening. or you can pair your growth factor gel with the retinol and do a thin layer. But if you're going to do all three, I would suggest spot treating with the human-derived growth factor gel, provide a peptide to full face and neck. And this does come in multiple sizes. You can always start with the 1 ounce size, which is pictured here, and then bump yourself up to the 3.4 ounce size. You guys will love it. And with the code FAB40, of course, you can have a discount there. We do also offer a 30 SPF moisturizer with MDPen. If you are in need of a new sunscreen, you can definitely try ours. And if you would like more information on our skincare or becoming a professional with us or any of the treatments or devices mentioned in this video, definitely reach out to us at MDPen. Thank you guys so much for your participation today. I hope you can catch me on LinkedIn tomorrow. I will be talking about first day of winter and making some great suggestions. Hope you guys are having a great week. Bye.